Leprosy is a chronic, infectious disease caused by the bacteria Mycobacterium leprae. It is most prominent in developing countries, but it has also been identified in Florida. The disease is often characterized by disfiguring skin sores, nerve damage, and muscle weakness. It is most common in tropical and subtropical regions, but leprosy has been detected in Florida and other areas of the United States. The disease is typically transmitted through contact with an infected individual, or through an animal or insect bite. It is not typically spread through casual contact with an individual with the disease. Leprosy can remain dormant in the body for a few years before it is identified. If left untreated, the disease can cause permanent physical damage such as nerve damage and deformities. The Centers for Disease Control and Prevention, CDC, has identified leprosy as a public health issue in Florida due to the prevalence of the infection among the population. The CDC estimates that there are approximately 600 active cases of leprosy in the United States each year, most of which are present in regions of Florida. The disease is most commonly seen in individuals from the Caribbean and other tropical regions who travel to Florida for work or pleasure. Those living in close contact with an infected individual are at higher risk for contracting the disease. The Florida Department of Health works proactively to reduce the incidence of leprosy in the state through a comprehensive program. This includes conducting research and outreach on the disease as well as providing public education on prevention and treatment. The state also works with healthcare providers to ensure early diagnosis and treatment. Additionally, the department collaborates with international organizations to create more awareness of the disease and ways to prevent it. Public health officials in Florida believe that leprosy does not pose a significant risk to the overall population, as the majority of cases are contained and treated before they spread to the general population. However, it is still important to be aware of the disease and take preventive measures. Individuals can protect themselves by learning the signs and symptoms of leprosy, and seeking treatment as soon as possible after diagnosis. It is also important to practice good hygiene and avoid contact with those who may be infected. The state of Florida has made it a priority to reduce the number of cases of leprosy in the state by providing resources, conducting research, and collaborating with other organizations to spread awareness. The state works with the CDC to help ensure that individuals are receiving the treatment they need and that rates of the disease remain low in the community. By taking a proactive approach to leprosy prevention, Florida is helping to reduce the risk of the disease being spread to others. The state has also implemented measures to increase testing for the disease, so that it can be quickly identified and contained. Florida is also working to reduce disparities in healthcare access by providing resources and outreach to vulnerable and underserved communities. This is an important part of reducing leprosy in Florida, as it can help to ensure that those at highest risk are able to receive the treatment they need. The state of Florida is also working to improve public health through initiatives such as the WHO Fidelis program and the GRACE initiative. These programs are designed to provide education, resources, and support to underserved populations who are disproportionately affected by the disease. To ensure leprosy is effectively managed in Florida, the state continues to collaborate with community organizations and health care providers to provide the appropriate resources and care.